grandparents can really bring so much, and grandkids, they love their grandparents.
Welcome to Talking About Kids. I am your host, R. Bradley Snyder, researcher, activist, and author of The 5 Simple Truths of Raising Kids. Autism is a spectrum disorder, meaning that it is defined by a variety of conditions that themselves may exist on continuums. This can make it difficult and anxiety provoking, even for parents of kids with autism spectrum disorder and their care teams to find the optimal combination of interventions. Thankfully, there are sources like Theresa Lyons' Navigating Autism website that critically review the latest research, unpack jargon, and debunk the myths and fad treatments. I respect Navigating Autism and Teresa's approach. So when she told me that she believes that grandparents play an important and underutilized role in treating kids, I wanted to learn more. Talking About Kids is sponsored in part by the Arizona Department of Health Services Must Stop Bullying campaign through its Title V Maternal and Child Health Program. For more information, go to muststopbullying.org. If you think these perspectives on the role of grandparents in treating kids with autism spectrum disorder might help kids in your life or community, please like this episode and then share the Talking About Kids podcast with your friends and colleagues. And now, the interview.
It all began with my daughter being diagnosed with autism. I would not have been doing any of the things I'm doing now if it wasn't for that. I have a background in the pharmaceutical industry, so it was really just shifting therapeutic areas. My research when I was going for my PhD was in structure-based drug design. So I was involved in different therapeutic areas for that. I worked in R&D, and again, it was more actually on the liver and how the body actually processes out the different pharmaceuticals. And then I switched over to the business side and got more experience in how pharma generates revenue. So all of that experience was very useful when my daughter was diagnosed with autism, because it allowed me then to use that expertise to really understand what is autism and what could her future be about.
And that word diagnosed is so interesting in the context of autism because I think, like, unlike many other things that somebody might be diagnosed with, the diagnostic process for autism is a little bit different. And so I know that I suspect that many of my listeners are going to be familiar with autism. They know people that have it. There's children in their home or in their classroom or in their programs. But let's talk a little bit about what autism is and also what it is not. Because in the work that you've done since then, I'm thinking specifically about your wonderful website, Navigating Autism, and where autism is spelled AWE,
Yes.
ism, autism,
Yep. Very
right?
important.
So, the idea of what autism is really important to a lot of what you write about and what you discuss and analyze on that site. So, in your own words, what is autism?
I think directly to chemistry. So my answer for
Right.
what in my mind is, understanding different biological processes and parts of the body that might not be performing optimally, and really how to optimize that. That is what is autism in the sense of the scientific literature, and how children improve and how they change. Um, but As far as autism, so AWETISM, that was my own learnings. So when my daughter was diagnosed with autism, I hated that word. That word,
Mhm.
I would say it, I would think it, and I would just think about how difficult everything is going to be and how this wasn't the parenting experience that I envisioned or that I even wanted.
Right.
And there was so much difficultness and stress and worry and anger and frustration that that one word just encapsulated all of that. So I didn't even like saying the word autism. I would say, on the spectrum and just try and avoid
Right.
it. And then as I started to improve my daughter's health, then I thought, "Oh my goodness, she must have been, having a headache for months, and she was still getting
Mm.
up and going to school, and she had, light sensitivity." Could you, just imagine just having bright lights all around you all the time and still trying to participate in life and go to school and go out for adventures and try and interact with people? And right, we think, oh, let's go to the park. It's nice and sunny out. But that might have been actually the worst time to take her to the park. But yet she would still try. So that's when I really had that perspective change. And I thought, oh, I'm in so much awe of all that she continued to try to do, even when her
Right.
health was impacted.
Well, I think one of the things that you talked about just then, I think, is something that we need to there's 2 elements of what you just said that I want to explore a little bit because I think it gets at a lot of what you're able to do with your website. The first is the fact that you're talking about your daughter. And until very, very recently, the number of children diagnosed with autism were overwhelmingly male, 85%
Mhm.
up until just a few years ago. And even and what we all suspected is that, well, obviously there are females out there that have this, but they might just be presenting in a way that we don't see or we don't understand. But the other thing you said is you would just talk about them being on a spectrum. Now, I want to bring that up because as a spectrum disorder, I think even myself, when I hear spectrum, I don't actually think spectrum, I think continuum, but that's not the case, right? There are so many different symptoms, so many different ways that autism is expressed in individuals, and they vary wildly by individuals, right?
Correct.
So, can you explain that a little bit to me, please?
Sure. And this gets into the question you were asking about, diagnosis and how is autism
Yeah,
diagnosed. So to answer that, diagnosis is made based on observation. So there's no blood test, there's no urine test, no stool test, no
right,
MRI. There's no way to get just a sheet of paper based on some quantity of something that says this is autism. So typically, how it's
right.
diagnosed is through observation. You get a speech evaluation and an occupational therapy evaluation and physical therapy and some type of learning aspect. You get all these evaluations. You go in front of a specialist. A general pediatrician is not allowed to make an autism diagnosis because they don't have training. So that's something to really keep in mind for parents who want to ask doctors about autism. You want to go to people who are actually trained in this. So a general pediatrician is not really going to be an expert in autism. And you go for that diagnosis, and the person there is going to read these different reports, and they might observe your child for 15 minutes or so. And then they'll come out with, okay, this is an autism diagnosis, but it's based on all those layers of observation. And
Yeah.
it can present so differently. So autism is broken down into levels. So you have level one, which used to be called Asperger's. So there's no longer an Asperger's diagnosis. And people who are familiar with Asperger's, the person is normally they have low level needs for daily living assistance, right? So they
Mhm.
might be able to dress themselves and walk to school safely, and maybe they would live on their own. They could cook and clean and manage that part. So that would be level one, but there will always be some aspect of repetitiveness or communication difficulties that
Mhm.
prevent them from really participating fully in life. So that's what the diagnosis is about. What is actually preventing this person from participating fully in life? So repetitiveness, OCD. So that's level one. And that person might be able to speak. They might have difficulties with having like an ebb and flow conversation back and forth.
Mhm.
But so their speech patterns will look very different than, let's say, level three, which might be someone who can't speak at all and
Right.
might have difficulty dressing themselves and maybe can't cut their own food or brush their teeth. They might not be able to cross the street safely, so they have different support needs, and all of that is autism.
Right, and even if you look at something like the DSM, which I know a lot of listeners are, familiar with, one of the things that's interesting about autism is how contextually dependent it is. So that we have certain of these symptoms that you're talking about. You've also talked about sensory integration
Mhm.
issues. That was, we had mentioned that early on. These are things that, like you said, are going to ebb and flow. Whereas with something, for example, like ADHD, it's part of the diagnostic criteria that you see it across different environments. It's supposed to exist in different environments, whereas autism is going to look really different in different environments for the same individual, which is also can be such a tricky thing with it, right?
Right. And so what also is it can change quite a bit day to day. So
Right.
really, one person, if you just watch them for one day, you might not get a full understanding of the challenges that they actually have. And challenges are different in school environments, right? Because demands are different, communication demands and needs are different, and the environment is different. So there is a sense of sometimes with parents, it's hard to get a control of the situation because it's always changing.
Well, it's so hard even for parents to find necessarily support because how their own child, who has a autism spectrum disorder diagnosis, they might be have very very different needs, very very different expressions than another parent, which means that it's even sometimes hard to bond with other parents or even
Yeah.
exchange tips,
Yes.
right? It can be such a hard thing. I don't mean to belabor this, but I think this is really important to kind of understanding kind of this niche that you have found in your work with navigating autism, because one of the things, in my opinion, because it is such a strange disorder that expresses and manifests in so many different ways, I think it has created this rich environment for people to kind of promote, um, promote interventions that don't work, promote interventions that and sometimes that capitalize on people's fears or anxieties about their children. There really is just a need for a broader way of thinking, and for people who are willing to do the hard work to look at the research. That's
Yes,
kind of why I wanted to go through that
the
really
science.
long explanation, right?
Yeah.
um and so in part of your own exploration, in your own you finding yourself in this world, at some point you discovered functional medicine.
Mhm.
How did that first come to your awareness?
Oh, that's a good question. The first time I learned about functional medicine, it's from okay, so I'll take you to way back 12 years ago when my daughter's diagnosed, and I say, okay, what do we do next? And
Yeah.
there's not a good plan. And coming from the pharmaceutical industry, right, where this is what I worked on. What is the standard of care, and what are the steps? That's
Yeah.
what I was expecting.
And then give a pill, right? And you do want exactly.
Well, give me
So
something. Give me metrics. What are we
yes.
shooting for? What is like? I need some concrete things to focus on so that I know where we stand. And so when I went into the research in PubMed and started reading, I read these articles, and there are a few sprinkled throughout the decades that showed autism was not permanent for everyone who gets diagnosed with autism.
Yeah.
And
Yeah.
so back when my daughter was diagnosed, that number was about 10%. So 10% of kids who lost their diagnosis, they called it an optimal outcome. And I called the researchers and talked to them and really wanted to is this possible? Because this is completely different than anything else that I'm hearing, that I'm reading on the internet.
Right.
And then I went about actually finding parents who were in that 10%, right? It was like,
Oh,
okay,
wow.
I really need to know if this is possible. So, I had stopped working and I was going all in. And so it was just like, okay, what am I going in for? And I was able to speak to about 40 or 50 parents. And I would talk to them what were the symptoms their child had and what did they do. And a lot of people were, talking about digestion first. So, understanding about the gut, and leaky gut was a new concept back then, 12 years ago or
Right.
so. So it was really understanding that aspect of what worked for kids, and then finding out who are the doctors that these parents have been working with, and reading their website, calling them, talking to them. That was really my first exposure to functional medicine, is from parents who had really improved their child's life. And it's not so, also autism is, this isn't about changing who your child is. So it's
Right.
not, saying, "Oh, there's something
Right.
wrong with them." There might be something wrong with their digestion, right? Which then leads to
Yeah.
constipation and leads to irritability and lack of sleep, and then they have trouble learning, right? So it's like, let's focus on the constipation, so then the child has that opportunity to be who they are. And that was really where I learned about functional medicine first, and it was through other parents.
Well, and by the way, that's so funny that you mentioned the gastrointestinal distress, because that actually, when I first learned of its prevalence among people with autism spectrum disorder diagnosis, that really changed my thinking
Mhm.
about autism for some reason. Well, not for some reason, because it was this physical manifestation that didn't seem to match how people were approaching the other symptoms and the other behaviors or impediments that were stopping these individuals from fully engaging with their environment, right? So we people were doing all this applied behavioral analysis, which was, gold standard for a long time.
Right.
That has
Still
nothing
is.
to do with the fact that you've got still is.
Still is.
And again, yep. We'll see if we get into that. I don't even know if I'm fully qualified to express all of the angles of that. But one of the things that's interesting about the fact that, according to some experts, virtually every person with an autism spectrum disorder diagnosis has had or continues to have some sort of gastrointestinal problem. Well, that doesn't get touched
No.
by applied behavioral analysis.
Nope. Not at all.
So those things, so then what is it, right? So that's what changed my thinking. So interesting that you brought that up. I started to look at this diagnosis very, very differently because of that.
And that's what is unfortunate about medical care and autism. Once that label is there, many
Yeah.
times then doctors just say, "Oh, that's just autism." So constipation is not autism, right? Diarrhea, gas, bloating,
Right.
hives, skin problems. There's so many symptoms that are not associated really with what autism is by a definition, right? And
Mm,
then doctors just say, well, that's what it is. Oh, they're anxious, that's just autism. Oh, they're not
right.
potty trained at night, that's just autism. And it's so unfortunate and just unfair, frankly, that so many of these other symptoms just get written off and are not addressed. Whereas if there was any other diagnosis or no diagnosis
Yeah.
whatsoever of autism, and you said, my child's constipated, what? This is not good. This can't go on for
Well,
the rest of their lives. But you have autism and somehow it's
yeah.
okay.
what I always took away from those kind of interactions, Teresa, is that too many people in the medical profession were more concerned with those symptoms that of autism that other people had to deal with and not concerned with the symptoms that the individual with autism had to contend with.
That's very well.
It's I don't wanna it doesn't bother me that they are having constant stomach cramps, that
Right.
this is a persistent thing. What bothers me is that their behavior is odd in a group setting.
Right, or
So
that
what's
they're
gonna happen is
rocking,
I'm gonna
right?
focus on that. Exactly.
Yeah.
Right. Their self-soothing behavior is a little off-putting to me, so we're gonna focus on that and not on the fact that they throw up almost every day.
Right.
Right?
Yeah.
That is crazy,
Yeah.
right? That would not be the case with anything else, to your point.
No, not at all, and that's the part that is entirely unfair, and then how can you expect a child to learn and want to interact with people and do things like that when there's so much biology that is just problematic?
Right. Well, and it even gets written off sometimes, and I know that I'm on a way big tangent here, and I apologize, but it even gets written off as somatic in this old misunderstood sense of that word, in the sense that it's all in someone's head, which is not actually what somatic means. It's also the case that even if there is a link to the person's brain function, which, by the way, so much of what all of us feel is directly related to brain function. Those individuals are still experiencing it as real pain and real distress.
Right.
So, just dismissing it as, oh no, this is just a symptom of this other neurological disorder that we have identified makes it seem like, well, that their pain isn't real and their pain is real.
Yeah, very much so. Very much.
So, how do you define functional medicine? Because it's also something that, even though it's getting a lot more attention, there still seems to be a lot of different ways to practice it.
Yeah.
So how do you
Yes.
define it?
All right. So with conventional medicine is what we think of when we go to the general doctor and large hospitals, things along those lines. And conventional medicine has a very short-term approach to resolving issues, right? So let's use the constipation example. Child's constipated, you go to a conventional medicine doctor, and they might say, "All right, you know what? Let's take some Miralax." Okay, great. We'll relieve the constipation, right? But if you stop the Miralax, then the constipation comes back. So functional medicine has more of a long-term view of
Right,
what's causing the constipation. So what is the reason? And that's what functional medicine does. It asks that question of why? What's happening? What's
right,
going on in the body? So it's totally fine to use both sides of those perspectives, right? So your child might need quick, immediate relief from constipation. You can also do it in other ways besides Miralax, but then you also want to say, okay, what was causing that? Let's resolve that so we don't have to deal with constipation again. That's the important part of functional medicine is to get at the root cause so it's not recurring.
absolutely. It just puts the child, in this case, talking about kids, we're talking about children, but it puts them in a context. So you absolutely don't want to ignore the symptoms or the distress that they're feeling, but you also want to look at, when does it occur? Is it a there a pattern
Eh,
to why something's occurring? Is there a certain type of day? Is there a certain food that precedes it? Is it a certain
Yeah,
right? So
yes,
these
all
are
of that.
all important things. And what's so odd is, and I don't know, you coming from a pharmaceutical background, not the you hear you'll get sometimes, medical professionals will roll their eyes at functional medicine in a way that we haven't rolled our eyes in any other social science when we've looked at the social ecological models of so many things. So when we look at poverty, when we look at crime, when we look at virtually anything else, we have for the last really 50 years tried to put it in a context and not just look at it as these weird random things that we're going to address only when they happen. But for medicine, we still are a little bit like we still think of it as new agey or something, or at least that's the vibe that some people give when they criticize it.
Well, I think it gets criticized, and I know for me, when I first was looking at functional medicine, I was criticizing it because I had to pay cash out of pocket, and I
Yeah,
thought, "This isn't right. If you're a doctor and you're a good doctor, you accept insurance, right?" So I had to understand and unpack that. So I think that's where some of that tension comes from because the Mayo Clinic has a functional medicine department, and a few larger hospitals are starting to have these functional medicine
yeah,
departments. So, it's coming along, but still, for the most part, functional medicine is something you do out of pocket. So that always raises flags for people in the sense of that's outside of what insurance says is good. And now I think we've come to a point where we've understood, okay, insurance doesn't always have our best interests, right? It should, but it doesn't always. But I know that was my hesitancy about functional medicine in the beginning, was just that it is out of pocket. And for good reason. Doctors' appointments in functional medicine a lot of times are like an hour long. You don't get that. You
yeah.
get like 8 minutes, right, with conventional medicine. So it's a different way of practicing, and I think that's where some of that criticism comes from.
Yeah, I mean, for those who want to know more, obviously there's a lot of resources that you could go to, but a great example of somebody working through functional medicine, albeit in a slightly different field of childhood trauma, is in Nadine Burke Harris's book, "The Deepest Well," and she talks very eloquently, because I think she's an excellent writer, about how she had to start paying attention to the context in which the children she was seeing were experiencing their symptoms. And she talks very eloquently about this boy that would have these asthma attacks. They were very, very real,
Mm,
but she couldn't keep treating the asthma. It wasn't doing anything, right?
yeah.
And when she started to look at the when they occurred,
Mhm.
under what conditions, that's when she was able to really impact this boy's life. And I won't give any more away than that. So even though when you talk about functional medicine, one of the issues is because it's now all kind of on the table, we're going to look at what people eat. We're going to look at when they eat. We're going to look at their sleep. We're going to look at their exercise. We're going to look at what is in the food that they're eating, not just the food that they're eating, right? We're going to pay a lot of attention to all these different things. In some ways, that even opens the door wider for people to come in with strange ideas about what might be, making certain symptoms or certain behaviors or certain maladies worse or better. And so it even, I think, creates an environment where you have to have greater scrutiny for what people are saying you should or should not do.
The important part is to use science to guide you. So,
Yeah.
there's a lot of different risk factors, right? And then this gets to the question you asked earlier about how, a lot of things get marketed as, oh, this works for autism. And you have people really advocating do this or do that. And I don't
Yeah.
advocate that whatsoever. What I teach parents is these are the things you need to consider. And this is the lab test for you to do. And if it comes back as this needs to focus on, this is the science that you need to learn. So there's a shift in the sense that autism is so complex, right? We talked about level one and level three. There's
Yeah.
not going to be one thing that is going to resolve everything for everyone on the spectrum. So the parents have to become really discerning, use science to guide them, and also say, okay, does my child have these symptoms? Is that something that is appropriate for them? Because we hear these things like, oh, this was fantastic and it changed this child's life. And sometimes parents think, okay, let me try that, right? But
Yeah.
you really want to have that time to analyze, okay, is this logical? Is this known to impact what is really important in our lives? And really to make decisions from that mindset rather than just a universal. Let me just try different things.
Yeah, and even when you are doing that kind of experimentation to see what works for you, the idea that you don't abandon everything else that has been working because there's something new and shiny, I think
Yes.
that's really important,
Yeah,
right?
it's additive for sure, and you wanna first start on things that are in many ways basic health, so sleep. So, there's, research that says up to 80% of kids with autism at some point are gonna have problems with
Yeah.
sleep, and some have problems for years, right? And so then that really impacts a child's health, and it impacts a parent's health. There's two research articles, and this was one of the earlier research that I read about how if a child with autism does not get quality sleep, the research
Yeah.
shows that their autism symptoms increase, right? And I thought,
Yeah.
oh, that is not the direction we want to go. So, sleep is very important. And it's also good to know that these symptoms, right, are variable. So, if lack of sleep makes them worse, could quality sleep make them better, right? So that's the kind of logic that you want to use when you're thinking about what to do for your child.
And by the way, Teresa, and I don't know what happened with this, but there was a big movement, boy, it's been 15, maybe 20 years ago now, inside the American Psychological Association, that you couldn't render any diagnosis of a child unless you've established that their nutrition and sleep were within certain parameters.
Oh,
Like you could,
interesting.
and we were, because it turns out that there were all of these things like ADHD that didn't exist in some kids if they were getting adequate sleep. So there was this big push for a while, like no diagnosis until you go through these steps to assure that their nutrition and their sleep were within certain parameters.
Mm,
I don't know what happened to that movement. It would be an interesting thing to explore,
yeah, would be.
but it's definitely real. Um, I know that boy, I came into this episode like a cannon. I just shot out of a cannon, and I've just been going in all these different directions with you because I'm excited about your approach, and I like what you've been doing. But one of the things that you have been advocating for, because as we've already said, there's no panacea, but you find that in interesting additive to a kid's treatment plan that you think really reaps benefits is integrating grandparents.
Definitely. Yes.
Let's talk about that a little bit. Why are grandparents an important part, an advantage to a child to get them involved in their treatment?
For so many reasons. So we can talk about one aspect of autism that is really overlooked, and that is the increased risk that parents of kids with autism receive a PTSD diagnosis based upon challenging behaviors and raising a child with autism. So, having a large support system is really important to the parents and the child. And there's a great small clinical trial that just came out from the Netherlands, and they had seven parents, it was five moms and two dads, that had PTSD diagnosis directly related to raising the child with autism and challenging behaviors. And they did EMDR, so it was like 5 to 7 sessions, and not only did the parents lose their PTSD diagnosis, the children, 5 out of 7 of the children, also improved their own emotional regulation. So there is
Mm,
this real importance for having that family involved with the child with autism, because the responsibility can't just be on the parents. It's too much. And grandparents many times want to help. What happens is there's a disconnect as to what would be helpful. So really having that initial conversation from the grandparent, acknowledging, listen, you are raising a child that you're having a different experience than I did. So I don't want to make it sound like you're doing anything wrong. I just want you to know I'm here to help. So what can I do? Do you want me to do research? Do you want me to cook dinner once a week? Do you want me to give you money? Do you want me to pay for, special schools or something along those lines? Grandparents can really bring so much, and grandkids, they love their grandparents. I've worked with so many kids with autism,
Right.
and as they get healthier, they are then able to express how meaningful it has been all along to have someone else in their life. So grandparents are a huge benefit. It just sometimes gets a little tense as to how do you have those three generations together working towards that common goal.
Well, it's also the other thing too that with kids who have the autism spectrum disorder diagnosis, um, they don't have they often don't have many relationships that are their own relationship. They have relationships that are through a parent or primarily with the parent. They can have a relationship with that grandparent that is their own relationship. It's a second relationship with a trusted adult that's still family, so it
Right.
still has that closeness, but it is a relationship that belongs to them. And I think that is so very important. We know that it's a building block of resilience, and so I
Definitely.
think I think that's really interesting. What's a tip? You talked about a tip for grandparents who want to be more actively involved. One of the things that you hear from a generation a little older than I am. I'm older than you are, Teresa, but even a generation older than me is that, autism didn't exist when they had kids.
Right.
You hear this a lot. So, what tips do you have for parents who are wanting to get their parents involved to kind of help their parents, now the grandparents, understand this issue and take a more active role?
Yeah, it really depends on what the relationship is to begin with. And so
Mm,
for some grandparents, I think many are really savvy now and they understand the autism rate is increasing. I think there is still some pushback where older generations might think, okay, when a child behaved like that, we would just, handle it in a very different way, right? So, it
right.
might be, taking off a shoe, "Don't make me," and kind of finish that line. So, sometimes grandparents of that generation think they should handle it differently. And so for that, you just child in the middle wants to educate the parent as to what exactly is going on. A lot of times, these are grandparents then that really resonate with science and with
Mm,
facts, right? Rather than kind of opinions and social media clips and things like that. So the more grounded in information these children can share with their parents who might not really have an understanding of what autism is would would be a way to get the conversation going. And it really is about having those conversations and does that child feel comfortable asking their parent for help? That
mm,
grandparent might be saying, oh, it's such a shame, the Johnny will never be able to do X, Y, or Z, right? And then that child might think, oh, I don't want you thinking about my child, how they can't do certain things. But that's where you have that conversation where you can say, you know, 37% of kids with autism lose their diagnosis. So let's not put limitations on what he can do, and he's only 5, right? So let's have
yeah.
more of an open mind. But a lot of times you really need information, hard scientific facts to open someone's mind to doing things a little differently.
This is purely anecdotal, but I'll throw this out there too, which is, that grandchild, especially as they get older, if part of how autism is being expressed in them is that they miss some social cues, they're going to be less annoyed at grandparents and some of those questions than other young people might be. They're going to be more accepting of their grandparents than some people might be, simply because they process interactions a little bit differently, and that can make for a very long and very rewarding relationship for all of them.
Yeah, it really can, but the grandparent has to be in that space of being open to things being
Right.
differently, and I think what helps someone get there is facts, real facts
Mm.
that show, okay, this is not a, a tantrum is very different than an autism meltdown, right? And so
Yeah.
maybe they need to have an understanding of the central nervous system and dysregulation, right? So those are all facts that can be clearly laid out so that if this grandparent is saying, we didn't let you have tantrums like that, and it's clearly an autism meltdown, then that's where education has to happen so that this grandparent says, wow, okay, we didn't have this when we were raising you, right? And that's the conclusion you want them to get. Like, this is an entirely different experience. And so you just might have to think about different ways to educate them on how things are different, but not in the sense that you're more lax in raising your child. Your child is just very different.
Well, Teresa, I just want to thank you so much for everything that you're doing on navigating autism. Obviously, there's going to be a link to it in the show notes. And I would encourage people that either have a kid in their classroom or a kid in their home or in their life that is experiencing this to go to navigating autism and look at some of these resources. And more importantly, really look at how Teresa takes on these questions and the analysis that she goes through and her analytic thinking, because I think it's very, very helpful. And obviously, Teresa, thank you for being a guest on Talking About Kids.
Thank you very much. This is my pleasure.
That was Theresa Lyons. More information about Teresa, including a link to navigating autism, is at talkingaboutkids.com. And when you do visit Talking About Kids, leave me a note. I would love to hear from you. The Talking About Kids theme song is by the Senators. For more of their music, go to thesenatorsmusic.com. And remember, kids are young goats and young humans, and the difference is that young goats are easier to manage.